When it comes to your health, having a strong relationship with a primary care doctor can make all of the difference out there. Today, we are joined by Dr. Raymond Christensen with UMD's medical school. Dr. Christensen, appreciate you being here. The American Medical Association says the U.S. is going to be short by as many as 86,000 physicians by the year 2036. Why do you think our nation is facing this growing shortage?
There's many reasons why that's happening. Over the years, I look back, I've been practicing for a long time, and the narrative on medicine really hasn't changed a lot. But at the same time, we have to sit back and look at what's been happening. We've trained a whole lot more physicians, a lot more NPs and PAs and others to help with the delivery of care. But at the same time, we've massively expanded our ability technically and medication-wise as far as taking care of patients. And we've also brought in the electronic medical record, which has been, in some ways, a heavy lift because it kind of cuts back a lot on the number of patients a person can see and make sure the records and so on are up to date. So all in all, I think if we look at it, we've trained a lot more physicians. We're doing a whole lot more than we did before, but we are still facing some of the same problems because of the fact that we're doing more and we have more responsibilities to each person.
And then for our viewers out there watching today who maybe haven't seen a primary care doctor in quite some time, could you give them some advice on just how important it is to get back on track with their health?
That's an interesting discussion that's going on. First of all, as we look at the state of Minnesota, we'll see variations in how these communities provide their medical care. Generally, the smaller the community, the larger percentage of family medicine. Family medicine is what I am. Family physicians are taught pediatrics and OB and surgery and internal medicine and pretty much all the specialties, and we can handle most of the things that come through our doors. And in the smaller communities, you're going to see more family physicians. Also, we do OB, and many do OB C-sections or C-sections, which provides care that's needed, especially in our larger geographic areas where we're dealing with distance and so on. At the same time, we need specialty medicine, again, dispersed across the state where the numbers and geography will allow that to happen. So at the present time, we're seeing a mix across the state of Minnesota, a matrix, if you will, of different numbers of specialists, different numbers of people. Back to primary care, the other piece that's really important is if you look at the specialty medicine, they've gotten more and more complex in the things that they do in their specialties. They need to know that the patients they're seeing have a well cared for base medical care. And that's really where family medicine's very important. Make sure that that happens. And the other piece with family medicine, it's important that somebody look at your health, be your person, your wilderness guide in medicine, if you will, and help guide you through your health.
And then for our viewers out there, if you haven't connected with your doctor lately, now might be the perfect time to do so. Dr. Raymond Christensen with UMD's Medical School. Doc, thanks for your time and sharing your knowledge with us today.
Thank you.